Good morning, everyone. Glad that we've come to this day. We've been waiting for this day for the launch of the Kenya Status Report on Infection Prevention and Control in Healthcare Facilities. And we are glad to have the Director General for Health, Dr. Patrick Amoth, as our guest of honor. And we are also expecting the CCM for Health for Machakos County, Dr. Daniel Yumbia. And we also have the Head of Public Health Department, Colonel Susan Mutua. And we have other guests. And of course, we've been here since Monday, and we are happy now that this day has come. And Bwana DG, please allow me to, as usual, we want to start this meeting with a word of prayer. So we have Mr. Musa from Kajiado. Are you here? Yes, go ahead. Amen. Thank you very much. So, Mr. DG, allow me to introduce you to these participants. We have had close to 75 participants since Monday. And I'll introduce them in blocks because we know you have a very busy schedule. And so we shall not allow all of them to say their names, but we appreciate their presence. The meeting has been very fruitful. We have officers from our counties, and we have 18 counties. We also have officers from Afya House, and we shall tell you which divisions and departments they come from. We also have some of our partners, and we have academia represented here. So allow me to request the team from Machakos just to stand up and wave at the DG. Team from Machakos? Thank you very much. Can we clap for them? So we have 3 officers per county from the County Director of Health and the County Public Health Officer and WASH Coordinator. So can we have Kajiado County, please? Thank you very much. Kajiado County is seated together, 3 officers. Can we clap for them? We have Kiambu County. Kiambu, are you there? Let's clap for Kiambu County, 3 officers. Thank you very much. Can we have Kisumu County? Kisumu, are you here? Thank you very much. Let's clap for Kisumu. And we have Nakuru County. Where are you, Nakuru? Thank you very much. 3 officers from Nakuru. Nyamira County. Thank you very much. Let's clap for Nyamira. We have Homa Bay County. Let's clap for Homa Bay team. Thank you very much. We have Mombasa County. Thank you very much. For Mombasa County, we have Narok. Thank you very much for Narok County. We have Laikipia County. Thank you. Let's clap for Laikipia. Then we have Murang'a County. Murang'a County, 2 officers. Thank you. We appreciate. Migori. Thank you very much for Migori County. Then we have Kitui County. Thank you, Kitui County. Trans Nzoia. Thank you very much, Trans Nzoia County. Then we have Makueni County, our neighboring county here. Where are you? Makueni is not here. We have Nyeri County. Nyeri is here. Thank you, Nyeri. We have Kirinyaga. Thank you very much, Kirinyaga. And we have Embu County. Embu, are you there? Let's clap for Embu County. Thank you very much, county representatives. Then, Bwana DG, we also have officers from Afya House. We have officers from WASH Division. Thank you very much, headed by Adam Ali. And I also work in WASH Division, sir. We also have officers from Food Safety. Thank you very much, officers from Food Safety. We have officers from Port Health Services. Thank you. Let's clap for them. We have occupational health and safety officers. Thank you very much. We have healthcare waste and climate change officers. Thank you. We have vector and vermin control division. Thank you very much. Then we have nursing. Division of nursing is also represented. Thank you very much. We have Directorate of Health Sector Intergovernmental Relations represented. Thank you very much. We also have the Division of Rehabilitation represented here. Where are you? Thank you very much. Then we have our partners. We have partners from AMREF Health Africa, and the program manager is sitting next to you, sir. Then we also have WASH Alliance. Thank you very much. We have academia. We have representatives from Mount Kenya University. Where are you? Thank you very much. Can we clap for her? And we have a representative from Washington State University. Thank you very much. So, sir, my role was to introduce the participants. I hope I've been able to do that appropriately, and I would like to hand over to Adam Ali, the head of WASH Division, to take over from me. Thank you.
Thank you, Janet. Thank you, Janet. Our DJ, our head of department, our partners. I want to appreciate your time for coming here. And I think it has been wonderful for your presence. I know with a tight schedule. And as you know, hospital-acquired infection is a critical issue in public health. And we are also cognizant of other IPCs taking place. So what we are talking about is WASH-based IPCs in this country. So as you might be aware, in 2019, WHO, UNICEF carried out an assessment report in 47 countries in the developing world. And actually, the report was less than 50% of those countries that were assessed actually did not meet the basic standard for WASH in healthcare facilities. And therefore, as part of that recommendation, they came up with some activities to be done by countries. And actually, this is in line with even our assessment of MOH assessment after COVID-19 outbreak pandemic in 2020 May. We did an assessment in our health facilities looking at the critical point, hand washing facility at critical point, and that is one of the activities we launched to assess our preparedness and status. And actually that report that came out in May also indicated that the 50% of our healthcare facilities actually met the requirement in those critical points. As part of the recommendation, the Division of WASH, with support of the Public Health Department, was able to partner with the WHO to see how best to fast-track those commitments Kenya country made on the issues of WASH in healthcare facilities. And therefore, in this workshop, the following areas of WASH in healthcare facilities are covered comprehensively through insourcing and outsourcing from specialists from WHO guideline, from WHO specialists. Actually, we have got counties that participated in our first assessment, which was like a piloting in 7 counties. Then we also have 11 counties that did not participate, but showed interest, and actually, because of other requirements, other conditions, they were able to participate and they were able to join us. So we were reviewing the WASH in healthcare facilities global report of 2019. What did the report say in specific countries of the 47 countries, and what were the recommendations given in those reports? Actually, the participants were able to be taken through that. Then WHO, UNICEF, 8 practical steps to achieve universal access to quality care. This was something that we went through for the last 3 days, 2 days we were here. We'll be continuing up to Friday. Actually, WHO has come up with the guidelines and manuals that actually we use, and actually those are also in the website and they are already in the public domain. But for our staff, we took them through those steps so that we're able to achieve the recommendation of WHO. Then we are supposed to be tracking. Our WASH in healthcare facilities is tracked digitally by WHO and the UN body. So how to do this tracking country progress on WASH in healthcare facilities was also covered in details. Actually, our expert in-house in-sourcing experts were able to take us through that, and the participants are now much familiar with that. Then we looked at the guidelines on care components of infection prevention and control programs at the national and acute healthcare facility levels. In those facilities where people come, and also we're looking at the guidelines that were developed for the purpose of WASH in healthcare facilities. Then the Kenya Health Facility Basic Hygiene and Hand Washing Assessment Tool. We were able to come up with a tool during the first piloting area for the 7 counties, and we were taking them through how we developed this tool and the processes that were developed. And actually, the thematic areas were looked at. So we are looking at also underscoring. There were thematic areas that we're looking at, 8 thematic areas, and actually scoring them in line with the WHO guideline, because all countries are supposed to be using one format, and that format is what is supposed to be used so that countries can be assessed uniformly. I know the details are also there in the WASH sector for more information, but then for the purpose of the standardized guideline that we have from WHO, we are supposed to use a uniform guideline, and we were able to take our participants through that guideline and also the scoring system of the system. Then healthcare selection and data collection methodology is an issue we went through. Our experts were able to take us through that, the issue of the healthcare selection and data collection methodology. And now today we are launching our findings for the 7 counties, and I'm sure many other counties have no much differences from what will be disseminated today. But then after this launching of our exercise, then we'll be going into details on what entails specific thematic areas, including the hygiene services in healthcare facilities. We'll be looking in more details into it. Then we'll be looking into details issues of sanitation services in healthcare facilities. We'll be looking at the specific interventions, specific thematic areas. Then we'll be looking at waste management services in healthcare facilities. Then the waste management service and the IPC services. Especially for us, the APC will be talking about those people who will be involved in cleaning and disinfecting, and those other people who usually we neglect them, and because they require specific PPEs and those other issues. So we are also looking at the WHO multimodal approach to hand hygiene. There are these models that were developed, and I think we will be going through those guidelines, and it will be much important to us. We will be looking at the guidelines to the implementation of the WHO multimodal hand hygiene improvement strategy. This is a strategy that is there. So as a country, we committed ourselves. When our high-level policy members went to Tanzania one time, including the first ladies, they signed those commitments, and actually it is part of that we are able to do these activities. So we'll be able to come up, counties are supposed to come up with an action plan, especially those counties that did not participate in the initial assessment. They'll be able to come up with a draft action plan and implement, and will be taken through the action plan preparation and step-by-step approach. There's a step that has already action plan that has been developed for us by WHO, and we'll be using that approach, and the participants will be taken through that step-by-step approach. Then we'll be coming up with a roadmap that will be able to guide the counties, each county, and we expect the participants from this workshop to share the roadmap, the draft roadmap they came up with, after taking them through this training, to share with their high-level policy decision makers at the county level, because we know sanitation, hygiene, water, health is a devolved function of the county government. We wish to have the high level of the county, the CECs, the governors, to be playing a key role in this. So we will request them to disseminate and share their draft report to the county staff, especially the county health management team, then they'll be able to share with the chief officers and also the CEC Health, and that is something that we'll be able to do a follow-up with them. And before June 2023, we wish to cover all the 47 counties, our director, our DJ, because all the counties must be able to report this, because as if the other counties are not reporting, then they'll be able to let us down in the assessment report, because there's an online tool that we're using to assess the healthcare facilities assessment report. And this one is digital and is all time around. And every 2 years, we are supposed to be given a report, just like the JMP reporting, and these are the issues. So I just want to stop there and say thank you, our DG, for coming and hosting to launching for us this important event. And at this juncture, I want to welcome our head of department, Madam Susan. Thank you.
Adam. Good morning, team. DG, we are glad to have your presence here, and the directors health services from counties who are here. You're very much welcome. Today's activity is the launching of the status report on infection prevention and control in healthcare facilities. As you've heard from Mr. Adam, there's an assessment that was done in 2018 for 47 countries. Kenya was not part of it. So we took that initiative sometime this year, sometime in May, and we have come up with a report, and it's going to act as our baseline report. So the purpose of this function is to launch it, and so that we are able to plan ahead and know how we are going to be assessing our facilities forthwith. There are some recommendations that were made during the World Health Assembly 2019, and some of those recommendations were to do a country healthcare facility assessment that we have done, disseminate a report, and that is what we are doing today, and develop WASH in healthcare facilities tracking system. I believe that we are also going to do. And then we do capacity building training for healthcare workers dealing with IPC, and that part of it is going to happen here. And then we are also going to have follow-up activities in the counties. So we are actually supposed to be reporting every 2 years to the UN on our achievements. And by 2025, we should be at least 80% compliant with IPC basic hygiene hand washing services. And the requirements are, just to mention the requirements that we are looking at, which are 8. We are talking about hand hygiene, general sanitation, PPE provision for cleaners, decontamination and sterilization of equipment, waste management, ventilation and lighting, safe and ample water provision, and cleaning schedules for the facilities. The reason why we are here, that is the purpose of this workshop and the objectives, what we are going to the deliverables we are going to have from here. This is to share the Kenya status reports on the IPC basic hygiene and hand washing services, to develop action plan towards scaling up basic hand washing for services assessment to cover health facilities, develop a roadmap towards completion of Kenya healthcare facilities WASH guidelines for WASH guidelines and standards, including score rating for the facilities, and then to reorient the health partners and policymakers on Kenya's commitments to universal access to basic hygiene and hand washing services. For the 7 counties that were represented, we are going to have this report. We are going to actually figure out what is in that report, how we are going to be improving, and we are looking at rolling out to the 47 counties forthwith. So, DG sir, we are hoping that you're going to launch this for us, and for the partners, we also want probably to hear a few words from you, and so that we are able to tie down all the loose ends and know where we are headed as a country. So with those few remarks, I would like to invite Amref Health Africa, who are part of our partners, to tell us what their role is and probably how they want to support the government in this issue. Thank you.
Thank you, Madam Susan, and our guest of honor, DG Dr. Patty Kamoth, the other distinguished guests, and ladies and gentlemen. I think this comes at the right time. One, of course, I want to take this opportunity to thank WHO, because I think during the initial stages of even looking at how we are going to do a quick rapid assessment in Kenya, all of us were involved in looking at the tools and adapting the tools to the Kenyan situation. And I think now with the report that is going to be launched today, it really moves Kenya to a greater step. I myself, on behalf of Family Health Africa in Kenya, and my name, Dr. is Daniel Kurau, and I serve as a WASH program manager. So I'm responsible for WASH services and WASH projects within the country. So the most important thing is that for us, we need to look at these things from the basics, because I think if we look at what has happened in the country for the many years and the kind of disease we are tackling, it is the basics that are failing us. If you want to start from sanitation, we know that it is so those things that relate to behavior that is really letting us down. And when you come to healthcare delivery, we cannot overemphasize the importance and the greatest role that WASH services play in quality healthcare delivery services. We cannot, as a country, I think it would be embarrassing to continue seeing customers coming to visit our facilities for services and go back with more conditions that they came with. These are the kind of things that we really need to fight and work together as a team. And as we have been discussing, and Daktari, it is very good, we have a very passionate team, and we have said it will never work unless we have teams that are going to be passionate. And when we say we'll provide leadership in provision of sanitation services, WASH services in healthcare facilities, we must know that it is an opportunity for us to stop many diseases. Those that are affecting our customers and those that are affecting also us as medical or health service providers, because we must protect ourselves at the same time. So what are the key questions? And I was looking at where we need to change, and I looked at all the practical steps, and I think one very important thing is the one on infrastructure. You know, yes, we have the skills, we have everything, but how often do we say, fix this running tap? How often do we say the cook in the kitchen requires to have PPEs, requires to be vaccinated, requires to practice appropriate hygiene when preparing food? How often do we say this clinician who is seeing patients in the outpatient has a room that is adequately lit, adequately ventilated, allows cross ventilation, and with a good sitting arrangement where the client and the health service provider is comfortable for that service delivery? We don't ask ourselves those questions, and they're very critical if you have to. How many times do we spend and see the working conditions of our mortuary staff and even the facilities within those business units? It is always we want to see the compound clean, and that is good because aesthetics are also part of treatment. So we need to see a facility that is clean and well kept with nice flower beds and everything. But the most important thing is that we are forgetting those small basics. And we repeated that this is shown and is multiplied through the actions and activities of the healthcare providers. So if all of us address this, I can assure you, even our customers who come, and I like using the word customer because, you know, in many health facilities we say visitors, but visitors are more of those people who are going for tourism and things like that. We need to treat our clients as real customers. And the power that we need now to ask ourselves is that what is the place of that community member? And I think we need to empower communities. We need to make sure our communities play a central role in management of our health services. So we have committees, and we are going to have IPC committees, and I think this is an opportunity where all of us can interact. So for partners, myself, the university, academia, and WASH Alliance, and the rest who are not here, we fully commit to be in this process. And we're even saying, colleagues, let us not be shy in putting some of this data in our CIDPs, so that as we work with counties to develop new projects, we will be saying we want to go to County X because we need to fix some WASH services within a number of health facilities. And we also become part and parcel of addressing this aspect because it is a global issue. It's a global issue because if we don't address it adequately, then we will continue being sick and we'll continue visiting these issues day and every day that we continue meeting to address aspects of quality healthcare delivery. So we want to thank WHO for the work that you have done, and we'll continue being together in this journey. And colleagues, as we come to do other projects in your counties, always get into us and say, we also have things that we need to program and focus. And for those of us who are WASH coordinators, please support those who are working in hospital sanitation so that we can develop programs to continue making sure that we take Kenya. I saw, Daktari, when we compared Kenya and Ethiopia, Ethiopia is well ahead of us. And we ask the questions, where did Ethiopia come and take and overtake Kenya? And I think we need to revisit this and make sure that as a strong East African member, we need to provide leadership and be one of the best countries that we can, other countries can come and benchmark. It is possible, it is doable, and we urge everybody to walk the journey with a passion. We as partners in healthcare are very ready to partner with you and take this agenda to the higher levels. Asanteni sana, and thank you so much for inviting us to this meeting.
Thank you, Mr. Kurao. Sir, I would also like to acknowledge the presence of CEO WASH Alliance, Mr. Omfoko. You can just stand up. That is Mr. Omfoko. We have been actually working with WASH Alliance from the Ministry of Health headquarters, and they've also been supporting the counties in these endeavors. And I would also wish to, at this point, to welcome the WHO representative, Mr. Nzioka, so that he can give his remarks.
Thank you very much, Madam Susan. DG, welcome to this meeting. I am not the WHO representative, but I'm here to represent his office. DG received his apologies. He was not able to be with us. He has some regional meeting that all WS from Africa are attending, so he sent his apologies. Please receive. So my name is Solomon Nzioka. I work in the area of public health and environment. Specifically, I have been the focal person for IPC throughout this period, and we've walked this journey together with your team, DG, and the partners, as it has been alluded by Mr. Kurao. Allow me, DG, to read WR's speech as it is, since that is my role currently. So these are the remarks by Dr. Diallo Abdurrahman, who is the WHO representative, Kenya Country Office. The Director General, Ministry of Health, health partners present, distinguished teams from county and national government. It's my great pleasure to attend this auspicious and memorable event, marking Kenya's progress in one of her regional and global commitments, that of meeting the 80% coverage on basic hygiene and hand washing services by 2025 and 100% universal coverage by 2030. This was during the World Health Assembly of 2019, where Kenya was amongst other 194 member state countries of WHO who committed to that endeavor. Recalling that the country reiterated these commitments during the Pan-African meeting on water, sanitation, and hygiene in healthcare facilities, an event that was hosted under the auspices of the Organization of African First Ladies for Development in May 2020, whereby during this event, Kenya's First Lady reiterated the need for having proper standards by end of that year of 2020. By the end of that year, and ring-fenced wash in healthcare facilities financing by 2023. I think that is next year. This includes direct budgeting from national accounts. So those were the deliberations from our First Ladies' accounts. So towards this, it is notable that country has made progress along the 8 practical steps that were alluded by the previous presenter for the national action and accountability as a basis of tracking progress. Indeed, this assessment report on basic hygiene and hand washing services is a foundational step under that continuum, which begins with a situation analysis, setting targets, and defining roadmap, establishing national infrastructure and maintenance, monitoring, health workforce development, community engagement, and conducting operational research. In the joint WHO-UNICEF report on WASH in healthcare facilities, subtitled Fundamentals First, it was noted that 1 out of 4, that's about 25%, of healthcare facilities lack basic water services. Again, 1 out of 3, that is 30%, lack basic hand washing facilities where care is given, including bathing places. This exposes more than 1.8 million people globally to the greater risk of infection. The situation was more dire in Africa. So this led to global call to action by the UN Secretary General to elevate this critical issue among all UN agencies, partner organizations, and member states. WHO is committed to deepening existing capacity in this critical area of work by organizing a series of regional webinars, as well as hands-on training of trainers in the area of WASH in healthcare facilities. To the DG, health partners, and all Kenyans, I offer my highest assurance that WHO will continue playing her role to support the country to deliver our commitments to our citizens and post positive developments to the regional and global commitments in the area of water, sanitation, and hygiene, including the related Sustainable Development Goals. Indeed, WHO is providing technical backstopping to this workshop, whose expected deliverables are to develop an action plan towards scaling up the basic hygiene and hand washing services, assessment to cover more facilities, and develop a roadmap towards completion of the Kenya Health Facilities WASH guidelines and standards. With this, I say WHO is proud to be associated with Kenya's progress, and I thank you for the continued collaboration. Thank you very much.
Thank you, Mr. Nzioka. The representative to the WHO representative to Kenya, that is correct? Thank you very much. So at this juncture, we would like to invite the CCM or his representative for Health Machakos. So welcome, and we are happy that you actually hosting us, and we are also happy that you actually participated in the assessment, so we can get a few remarks from you.
I'm a representative. Yes, thank you. So Director General Dr. Patrick Amoth, WHO representative, AMREF representative, all the county representative, and all the WASH partners on board, and all distinguished guests, all protocol observed, good morning. I'm Dr. Sharon Mweni, the Director Medical Services, Machakos County. I'm representing our CCM Health, Dr. Daniel Yumbia. Receive apology, Dr. Patrick Amoth. Waziri was not able to attend this important function. He had other urgent issues that came up this morning that he had to attend to. I would first would like to welcome you all to Machakos County, the place to be. We are the host, so I hope as you are coming along, you also appreciated our tourist sites. And even after this, you're welcome to visit around. I would really like to thank AMREF and WHO and all the WASH partners for the support they've accorded us, and also for selecting Machakos County in this important exercise whereby we were assessed on availability and the use of WASH facility in our level 2 and level 3 facility sample from Mwala sub-county. And today we are meeting here to share the findings from the 7 counties, and also to just know, to have a baseline on where we are and the current situation in our health facility. This is an important exercise, even in all a county. I know all of you, in all the county, all of you can attest that IPC practices and water and sanitation hygiene practices helps a lot in reducing the burden of infectious diseases in both our community and even our health care workers where we offer services. So we should start from the community all the way to the facility. In our county, it is more on the facility side, but now there's need to also focus on the community, because it starts from the community all the way to the facility. So I'm really excited about this activity, just to know our current association and have a way forward and an action plan on the same. And I would also want to welcome Director Patrick Amoth. Karibu sana to Machakos County, and thank you for joining us to launch these services. So asanteni sana. Thank you.
Thank you, Machakos representative. And DG sir, at this juncture, I would like to welcome you again. Your presence in this meeting gives the meeting the trajectory required in implementation of the general WASH requirements in the country. And in front of you are your foot soldiers, the people who are actually eager to receive this report and run away with it. So, DG sir, welcome, and give us your words.
Thanks, Susan. The representative of the CCM for Machakos, colleagues from the Ministry headquarters, representative from AMREF South Africa, the representative of the WR, colleagues from the WASH Alliance, academia presented here, county directors of health, county public health officers, and county WASH focal persons. Ladies and gentlemen, good morning. Before I read my official speech, allow me to take a few reflections as to why I decided to join you today on this auspicious occasion of the launch of this important document. And I think the launch is coming at a very good time because of the lessons that we have learned during the COVID-19 pandemic, during which we really place a lot of emphasis on infection prevention and control. and we saw the dramatic effects of the measures or the interventions we put in place regarding some of the infections, communicable conditions that arise as a result of not practicing good IPC measures. We are all very, very much aware of the cases, reduced cases of diarrheal diseases during the pandemic as a result of the infection prevention control measures we put in place, specifically hand washing with soap and water. But now that the pandemic is under control, we are back to our factory settings. And we are not practicing infection prevention control measures, specifically hand washing, at the community level, at the household level, and also in healthcare facilities. It is very difficult to be able to understand human behavior. In fact, I was talking to the African Union representative of the African Medicines Agency, who used to be a former executive director of UNAIDS and who was a former minister for health for Mali, Michel Sidibe, whose daughter is a global champion for hand washing, as to why, in spite of the presence of the facilities for hand washing and infection prevention control, we simply ignore them. Why is it that you have used a sanitation facility, there's soap, there's water, and after you're done with your business, you simply walk out and you shake the next person's hand you meet at the corridor? So in our discussions with him and the cabinet secretary, we are trying to understand how can we be able to influence human behavior so that we can be able to practice the correct things in spite of the availability of these resources. So one of the challenges that I want to throw at you is that even in the health facilities where these services are available, what is the utilization level? How do we track that utilization level to ensure that it forms part of our behavior? That immediately I've finished seeing a client or a customer, before I see the next one, I quickly walk to the tap, wash my hands with soap and water before I handle the next customer. How do we enforce that practice? Are we going to put cameras in all the consultation rooms or where we are seeing our clients to ensure that that practice is enforced? It is one thing making documents which stipulate what we ought to do, and a totally different ball game to ensure that what we have captured in the documents is implemented to the letter. So I want us to be able to reflect back and see, as much as we are developing these documents, how are we going to ensure that we track implementation of those basic things? As a country, we are in our scale-up of universal health coverage, which is premised on a primary healthcare approach. There's strong emphasis on health prevention, strong community participation, and health promotion. And you know the dividends that come about with prevention compared to curative services. Our health indicators have changed, though not much, and that is why we have had a paradigm shift to go back to the basics. I think our colleague from AMREF talked about basics. That is why I want to go now. We want to focus more on prevention, promotion, strong community participation. And if you also look at the Kenya Health Policy 2014-2030, policy thrust number 1, talks of eliminating communicable diseases. I think we need to be able to up our practices so that we can be able to influence the people that we serve correctly, so that they can also be able to practice the right things when they go back to the household level. Imagine a mother who has brought a child to the child welfare clinic. You've seen the child, you have had this long discussion. After seeing the child, you simply remove your gloves or whatever PPE equipment you are donning. You don't clean your hands. How are you going to influence that mother to be able to ensure that when she goes back home, after changing the baby's nappies or diapers, then she washes her hands before preparing the family's meal? IPC is the greatest thing that we need to practice as a low middle income countries because of our limited resources, and I can talk for the whole day, so allow me to go to the formal speech so that I don't bore you down. Ladies and gentlemen, I'm pleased to join you this morning in this important meeting to discuss key issues of hygiene and sanitation that prevents diseases and promotes human dignity and well-being, making it the perfect expression of WHO's definition of health. That is also in sync with our Constitution 2010 under the Bill of Rights, which ensures that everybody has access to the best healthcare services and also proper sanitation facilities. Healthcare settings, including hospitals, health centers, dispensaries, and general practitioners' facilities, provide an opportunity to educate visitors and the general population about minimizing disease transmission by providing targeted messages and a model safe environment. And in just my previous remarks, then that model environment must reflect what we want the community to be able to practice at household level. The development and implementation of our national policies, guidelines on safe practices, training and promotion of effective messages in a context of health facility, medical facilities will decrease the number of infections associated within the healthcare settings. The basic hygiene and hand washing services in health facilities assessment report before us today touches on the core of infection prevention control, and it comes at a time when the country is still dealing with the COVID-19 pandemic and the ongoing cholera outbreak in 10 counties and the high alert level that we are in regarding the Ebola outbreak in our neighboring country of Uganda. In all these outbreaks, what underpins management and control of outbreaks, IPC plays a critical role. If you are talking about COVID-19, if you talk about cholera, if you talk about Ebola, and as we say clearly, outbreaks begins with communities, outbreaks end with communities. Our role as healthcare workers is basically to be able to facilitate communities to be able to bring the outbreaks to an end. And one way of empowering communities to be able to bring outbreaks to an end is by highlighting infection prevention control measures. The problem of diseases from unsafe healthcare settings is growing worldwide and getting worse by the day. Worldwide also there's increasing provision of healthcare services, which is also becoming more complex by the day. And under such settings, healthcare authorities should fulfill their responsibility to ensure access to safe sanitation in health facilities for patients, staff, and caregivers, and to protect nearby communities from exposure to untreated wastewater, fecal sludge, and air pollution. Adan and in his remarks earlier showed us the global burden, and the burden, of course, is highest in low-income countries, where access to safe water in healthcare facilities is very, very low. And we need to strive as a country. I'm glad this was done in 7 pilot counties, but we need to quickly scale up to the remaining 40 counties so that when we do the assessment, then our score will be reasonable. Healthcare authorities are directly responsible for ensuring that all healthcare facilities have adequate sanitation systems for staff, patients, and caregivers, and that there are effective procedures in place to ensure safe management of fecal waste. Decontamination and sterilization of medical equipment is impossible where water supply is insufficient in health facilities, and also there is erratic electricity supply. This is clearly demonstrated now with the ongoing cholera outbreak that has affected 10 counties. One of them, of course, the 3 counties with the highest burden is Garissa, followed by Machakos and Nairobi. And this, of course, is also related to the drought situation, which has been ongoing for a long period of time. And therefore, we must also strive together as a community, as one whole society, to ensure sufficient provision of safe drinking and potable water, and not only for health facilities, but also at household level. Ladies and gentlemen, hospital-acquired infections or nosocomial infections contribute to avoidable morbidity and mortality and unnecessary burden to the health sector and additional constraints on household resources. Already as a country, if you look at our total health expenditure from the last national health accounts of 2019-2020, as a health sector, we spend 550 billion Kenya shillings in totality. That is the total amount of money we spend in the health sector. 20% of that is for purchase of various health products and technologies. That's about 110 billion. And again, out of this 550 billion, 25% of the spend is from our own pockets, out-of-pocket expenditure. And therefore, when you get a hospital-acquired infection, and usually hospital-acquired infections are more difficult to treat because the bugs have been exposed to antimicrobials. Therefore, that increases the cost of providing health care. And if you increase the cost of providing health care, then we cannot be able to achieve UHC, because when you're talking of UHC, you are basically saying that all Kenyans have access to basic essential healthcare services without suffering financial hardship. As we sit here, 36% of the Kenyan population is at a risk of catastrophic health expenditure and falling into abject poverty. So we are literally all a disease away. 36% of the population is one disease away from falling into abject poverty, where you sell all your assets. For example, if you are diagnosed with cancer today, I can tell you in the next 12 months, if you have a car, that car will not be yours no more. Therefore, if you can be able to prevent this, then we can be able to reduce the cost of providing health care, we can be able to reduce out-of-pocket expenditure, and our journey towards UHC becomes a reality. With the limited resources we have, then, as a low-middle-income country, then it is very, very imperative that we really put a lot of emphasis on prevention, prevention, prevention. It is worth noting from the global report of WHO and UNICEF 2019 that more than 90% of healthcare workers do not adhere to recommended hand hygiene practices. And that is the challenge I throw to you, that once we have these interventions in place, how do we get champions who can be able to influence others to be able to practice the right thing? How do we impact on that behavior change of healthcare workers, that it becomes something automatic? Immediately you see a patient or a client, after you're done with a client, is to move to the sink and be able to wash your hands. In some circumstances, people may choose not to seek care because the nearest health facilities are not functioning, or because treatment is uncertain due to shortages of water, electricity, supplies, and health workforce. And truly speaking, 13% of the Kenyan population don't seek health services in our formal health facilities because they simply cannot afford it. The situation is, however, dire at our facilities, and the assessment lays bare some of the inequalities that not only exist amongst the counties, but also across the levels of care, from the current status of basic hygiene and hand washing services as assessed for Kenya. Most of the parameters assessed are within the WHO UNICEF findings. The report also highlighted the need to address basic infection prevention control components so as to avert unnecessary disease burden arising from healthcare settings. The national IPC policy, however, recommends for the availability of water at all times and in sufficient quantities. For example, in Kenya, 64% of the health facilities have adequate water. So a huge percentage, 36%, don't have access to adequate water. However, this is skewed with assessment indicating water availability increases with the level of care at 53%, 63%, 80%, and 100% along the levels of care from level 2 to level 5. So at level 2, availability of water is 53%. So we need to be able to change this, because if we are to go in the direction of universal health coverage, where do most people get the services then? At level 2 facilities. So instead of level 2 facilities having 53% access to clean water, we need to quickly move that to 100% in the shortest period possible. Of course, water is also another social determinant of health and plays a key catalytic effect in galvanizing the health interventions to be able to improve population health. Through this assessment, it has, however, been established that although 64% of health facilities had adequate water, water was unsafe in nearly 50% of the facilities. So another dilemma. You have water, but the water that you have is unsafe. It therefore means we need to be able to be innovative enough to be able to come up with solutions to ensure that that water that is unavailable, that is unsafe, then we can be able to make it safe within the healthcare settings. Also, 58% did not have adequate hand washing stations, 62% did not have functioning hygiene stations at points of care, 45% did not have dedicated decontamination area, and 21% did not have reliable sterile material supply or sterilization equipment. To improve the low coverage, it is recommended for the county leadership to take key advocacy roles as county goodwill ambassadors. More urgently, it is recommended that the basic hygiene and hand washing services be integrated into the development process, such as the County Development Integrated Plan, DIPs. It has been shown that for every dollar invested in these basic services, there's a $15 return. That is better than even the best Ponzi scheme. To achieve the national and global universal target of 80% coverage by 2025 and 100% by 2030, it is further been shown that this will require investing close to $0.7 per person, that is close to 80 shillings per person, over the next years to be able to achieve that target by 2025 and the 100% target by 2030. That is a significant financial investment, but a journey of 1,000 miles begins with one step. As part of the solution, I'm aware that WHO and UNICEF have committed to building capacity in the upcoming water sanitation facility improvement toolkit, wash fit, and training of trainers in the coming days. This will go a long way in getting the requisite capacities in all our counties. Most of these findings and recommendations are within the Kenya Status Report on Infection Prevention Control that we are launching today. From this report, I expect that this team, comprising of senior managers from county level and the headquarters and the health partners working together with us, will come up with a scale-up plan for further assessment in order to cover more counties, not more counties, but in order to cover the 40 remaining counties and health facilities and a roadmap towards completion of the Kenya healthcare facilities WASH guidelines and standards, including possibility of having IPC score for star rating healthcare facilities. We need to be able to come up with a scorecard, to be able to tell us which is the best facility in terms of WASH and IPC interventions in the entire country. And at the annual health summit, then we should be able to vet those people who have performed well and congratulate them and encourage other people to go and benchmark and see what they are doing and quickly learn and adapt to their own or local context to achieve the same star rating. With these many remarks, it is my honor and pleasure to declare the 2022 Kenya Health Status Report on Infection Prevention Control, Basic Hygiene and Hand Washing Services officially launched. I thank you.
I think our DG will be able to start the report. Let them do some
cutting this ribbon to mark the launch of Kenya Status Report on Infection Prevention and Control in healthcare facilities, basic hygiene and hand washing services.
Now for the counties that participated, Madam DG, I want you to my county, Janet will read to us the counties that will come.
Thank you.
Which county?
So, Machakos County, please come and pick your package. Can we clap for them as they come? Thank you very much. There's the director pick for Machakos. Thank you. Can Kajiado County follow Machakos, please? Kajiado County, and should be followed by Kiambu County. Let's clap for them as they come. Can we have Kisumu to follow Kiambu County? Let's clap. Let's keep clapping. Thank you. Can we have Nakuru follow Kiambu County, followed by Kisumu County? Let's clap for Kisumu. Thank you. Nakuru County. Let's clap for Nakuru, followed by Nyamira County. Let's clap for them. Nyamira will be followed by Homa Bay. Let's clap for Homa Bay. Thank you very much. Thank you. Now we shall request the representative of the CEC-CM Health Machakos to present to the following counties. So let's have Mombasa. Mombasa County. Clap for them as they come. Let's have Narok. Thank you very much. Narok will be followed by Laikipia. Let's clap for Narok as he comes. Thank you very much. So Laikipia is coming. Let's clap for Laikipia as she comes. Laikipia will be followed by Murang'a. Murang'a County. Murang'a will be followed by Migori. Let's keep clapping, please. And Migori will be followed by Kitui. That is Migori coming. Let's clap for Migori, please. Migori will be followed by Kitui County. Let's clap for Kitui. Then the remaining counties, the presentation will be done by Dr. Solomon Zioka. So can we have Trans Nzoia? Let's clap for Trans Nzoia. Trans Nzoia will be followed by Makueni. Sorry, Makueni is not here. Will be followed by Nyeri. Let's clap for them, please. Thank you very much. Nyeri County. Thank you. Let's clap for Nyeri, please. And then Kirinyaga County. Yes, let the photos be clear. Kirinyaga County. Then last but not least, Embu County. Let's clap for Embu County. So thank you very much. Over to you, madam. Sorry, Embu, clap for Embu, please. Thank you very much. So our guests, please, you can take your seats. And thank you very much.
Thank you, Janet. I've heard someone saying down there, it is upside down. I would like to tell you that the information in there is not upside down, and it's going to be implemented to the latter. So it has been a good event, and I would like to thank you for coming in. Of course, there is a person who is going to be giving the vote of thanks. It's totally not me. So for the counties that are here, I would suggest that we don't keep those books on the shelves. Let them not gather dust. Let us put, people have invested in them. We have also invested a lot of knowledge in them, and a lot of thought process has actually gone into that. So we need to go ahead and figure every single sentence out and try to implement them to the latter. And did you? Okay, so thank you. I would like to invite someone to give the vote of thanks and probably to give us the way forward from here.
Our director, the DJ, the representative, colleagues from the counties, we want to most sincerely appreciate your participation from the very 7 counties who started this process, and we have come this far. We want to thank you, the head of department, for having graced this occasion. And this document, I want to believe that it's not going to be put in the shelves. It will actually be taken to the counties so that the communities can be engaged in having this done. And for that, please allow me to say that the workshop is on, and basically now is a question of breaking. We come back and proceed with the program. Our partners, we are most sincerely welcome to be with us until the end of the workshop. God bless each one of us.